Okay.
Hey, welcome to the 2022 King's Washington Area Alumni Club's Career Day program. My name is John Wetterau, and I'm a member of the King's College class of 1970. I'm also a proud member of the King's College Washington Area Alumni Club's Executive Committee, commonly known as KWAC, KWAC, which is basically what everybody calls us. I'm happy to welcome each of you here. Tonight we have students, we have presenters, we've got alumni, we've got friends, and also King staff to our second virtual KWAC Career Day program. KWAC Career Day is traditionally hosted here in the Washington, D.C. area by the KWAC Executive Committee. For many years, the exciting program has provided a wide range of professional opportunities to King students, thanks to the generosity of many King's DC area alumni and friends, many of whom are presenting and or observing in the sessions this year. If you haven't already, please be sure to mute yourself while our presenters are speaking. There will be a time for questions and answers, so save your questions for that time. And when you do have a question, feel free to unmute and ask it, or put your questions in the meantime in the chat feature on the program. This year, we've had 6 terrific sessions. We've had 2 on Tuesday night, 2 on Wednesday night, and our last 2 tonight. And to begin, I'd like to, this session, of course, is called Healthcare Career Opportunities in the Greater Washington, D.C. area. Okay. I'll be the host tonight for this session, but I'm also going to be the moderator. So this is my opportunity to be a moderator for one of the sessions. I've hosted all the 6 sessions, but I'm a moderator. Just a quick capsule of myself. Like I said before, I'm a King's College graduate, a bachelor's degree in mathematics, a minor in education in 1970. I got a master's degree from the University of Pennsylvania in 1977 in governmental administration. And my career was predominantly federal civil service. I retired in 2011 with 37 years of federal civil service, all Department of Defense, 20 years working for the Navy and 17 years working for the Army, predominantly in the contracting field. My last assignment was in the healthcare field, but not in the medical part of it, but in the healthcare field. I was a strategic planner at Walter Reed Army Medical Center in Washington, D.C. at the old Walter Reed. And my office was responsible for closing the Walter Reed Army Medical Center in 2011. And that's when I retired once that. I'm also a retired Lieutenant Colonel in the Pennsylvania National Guard. I retired from that in 1999 after 29 years in the Pennsylvania Guard. So that's pretty much my bio. It's not important for me, not important for us. We're greatly impressed to hear our speaker tonight, which is Robert Smith. Robert Smith's enthusiasm for public health was ignited when he pursued a BS degree in health sciences from Marymount University. Marymount University is a university in Northern Virginia, right across the river from DC. After his graduation in 2018, he went back to school to receive a master's in public health education and promotion, again from Marymount University, while gaining valuable experience as a lab tech, researcher, healthcare data analyst, and whatever. Presently, he works for the Washington Regional Transplant Community. He, in that particular job, which he'll go into detail on, he deals with 46 hospitals in the greater Washington area and 6 transplant centers. He'll talk to you about a lot of the medical concerns that he has and he deals with in this. Well, he deals with 46 hospitals on a regular basis, and also the opportunities that are available in the medical field. So with that, let me turn it over to Robert Smith. It's all yours, Robert.
Thank you very much. That was a great introduction. So first off, who am I? Again, my name is Robert Smith. I'm originally from England, so I actually came over to America as an international student. So if there are any international students, I can answer any particular questions there as well. Like you said, my education was at Marymount University, which my wife is an alum at King's College, and we always joke that the universities are quite copy and paste of each other. It's very similar, and I've been to King's quite a lot of times, and every time it feels like being back at university. So my education was primarily, my undergrad was focused in health sciences, so more towards physical therapy. And then about halfway through that program, I realized that I loved helping communities as opposed to the individual person. So I went back to get my master's in public health. I currently work in healthcare as a donation coordinator and a hospital services specialist. And I'll go into that a little bit more in a little bit. But first off, why did I pick DC? I get that question a lot. You know, coming from England, I was looking at everywhere from Canada all the way over to Colorado, Virginia. So why did I pick DC? The main reason is because of just how many job opportunities are nearby. I mean, if you're thinking about quantity of jobs, like John mentioned, there are 45 hospitals and 6 transplant centers in our service area. That is a lot of healthcare opportunities to work in. And the farthest hospital away is about 2.5 hours from where I live. So all of those hospitals are within this small little area. How am I connected to King's? So there's a little joke there, S&W, which was a little place to go to, which, you know, I kind of fell in love with going there a few times. And like I mentioned, my wife, she's an alum at King's College. She actually spoke yesterday. And as you can see, we were there probably a couple months ago, I would say. And that's our dog by the statue. We just had to get a picture. So this is a map of where Marymount is in Arlington, Virginia. So like I mentioned, I received my undergrad in 2018 from Marymount University, bachelor's in health sciences, pre-PT, and then a public health minor. And honestly, it was that minor that helped me realize where my true passion was. It kind of came out of nowhere. I was doing it because all I had to do was add a couple more classes to get a minor. And I ended up loving the epidemiology courses and the public health courses that it kind of caught me by surprise. And that's when I realized what I really wanted to do. I received my graduate degree in 2020. And yeah, it was a master's in health education and promotion. So one question I get quite a lot is, why go back for that graduate degree? The main reason was I did not feel like I was well equipped for what I wanted to go into, just education-wise, to work in the public health field. So I wanted a little bit more time to see where my particular focus was. Something I kind of joke about a little bit is, of course, my focus in grad school was in epidemiology, and I graduated in 2020. And of course, that's when the COVID pandemic hit. So it kind of felt like I did all this studying for epidemiology, and then my final exam was real life. So it was kind of interesting learning about all these pandemics and then kind of going into one. And then of course, upcoming this year, I'll be getting my EMT and EMS certifications at GW. That's just, there are so many educational opportunities in healthcare in the area that my organization is actually paying for it, which you'll see a lot of organizations will help pay for education. So something that really helped me, again, this is my dog, my wife and I. If you didn't know, Donate Life Month is actually next month to celebrate those organ donors. And as an international student, I ran into a really big problem immediately. And that was that you can only work a maximum of 20 hours per week, no matter how many jobs. If you had 4 jobs, a maximum of 20 hours per week on campus. So I worked 20 hours every single week just to try to get some money. And one thing that I did for 5 years was a desk assistant. And I found it quite easy to do homework while also being a desk assistant. So it kind of worked out both ways. an orientation leader for a couple of years, and then summer soccer coaches. And there were a lot of unknown benefits to doing these on-campus jobs that I didn't realize until later. And one is that as a desk assistant, I was doing the 11 p.m. to 7 a.m. shifts, and then going straight into an 8 a.m. class. And that's basically what my work life is now. Working in healthcare, especially working in a hospital, you're not working 9 to 5. You're working 7, like 7 a.m. is probably when most day shifts start. But if you're working night shifts, it kind of helps to get used to these really weird hours. For internships and volunteer work was something that was definitely a big part of my university education, mainly because there was no cap on how often you could volunteer. So it was great to get that work experience. I always felt like I was investing in myself by, even though I wasn't getting paid, I was going out there and getting a couple more names or words on my resume to help me stand out. As you can see here with my internship, I kind of interned at every possible area when it comes to public health. So I interned as an athletic trainer at the FDIC. So it was a little bit of experience as a federal employee, just with all of the little uniqueness that is to a federal building. I worked for the older adult population in Falls Church. I was a graduate assistant for our exercise physiology department, which I've met my favorite professor ever there. And, it was something that I kind of took for advantage, having this great connection with your teacher, because we still talk to this day. And I ask her a bunch of questions and I still annoy her to this day. I was an intern at Med Science Research Group. So I was leading a research organization looking at the effects of allergies on the lungs, and primarily the education that physicians have about allergies. So something we looked at was, do these primary care physicians know a lot about allergies, or is it something that's kind of misunderstood? And that's when I started getting that experience talking to physicians. And if you've ever talked to an attending physician, it can be a very unique experience. You'll probably find out. So volunteer or experience really, really helped in trying to find out what career I wanted to be in. I tried every single avenue when it came to public health and using my degree, and it really helped. I mean, the first month of every job, you're really excited, and then you see what things you like, what things you don't. So it definitely helped me in my job search. And that kind of led me to WRTC. So WRTC is a Washington Regional Transplant Community. We are responsible for the recovery and the allocation side of donated organs, eyes, and tissues for transplant, education, and research. So currently there are just over 106,000 people waiting for a life-saving organ, and 85% of those people are waiting for a kidney. The average wait for a kidney is 8 to 10 years. So I can't imagine doing dialysis for hours 3 times a week for 8 to 10 years. Every 9 minutes, someone else is added to the list of people waiting, and every day, 17 people die. So this organization is really good at making you, want to work for the mission, because you see that number, and every day 17 people are dying needing those life-saving organs. The thing with healthcare is, of course, I mentioned it a little bit before, we are on call 24/7, 365. So something I always tell the nurses is, if it is 3 a.m. on Christmas Day, please still give us a call. There is no time structure to healthcare. And if you ever want to experience that, please just try to set up an appointment with 1 or 2 people and try to have everyone be on time, because it is impossible. Something always pops up and people are always late or cannot make it. Organ and tissue donation. So one reason why there are so many people on that waiting list is less than 1% of hospital deaths each year occur in a way where organ donation is even possible. So that's 3 in every 1,000 patient deaths. The main reason for that is because every patient has to be on a ventilator when they pass away. There are 3 pathways to organ donation. So there's a brain dead donor, donation after circulatory death, and living donation. So something interesting is if you want to work in living donation, then you need to work in the transplant centers, because that's something that the transplant centers handle all themselves. We may assist on the recoveries and the surgery, but in reality, they can do that all of themselves. What we work on mainly is the brain dead donor and donation after circulatory death. And all you really need to know about that is there are 2 ways that someone can pass away. One way is if their heart stops, and one way is if their brain dies. So it's a very unique population that you're working with. One thing that's always interesting in my line of work is trying to explain to families what brain death is. So that's something that really has tested my personal skills with families, trying to build rapport in 30 seconds with the family when all they're doing is hearing every 3rd word you say. You know, they've just lost their child, they've just lost their parent, their partner, and you're trying to explain to them something complicated like brain death. So it is really interesting to go from talking to an attending physician, like a neurologist, and then going to talk to a family member who may not understand what brain death is. And of course, brain death is really hard for families to understand. I mean, you see your loved one's chest still rising and falling. Your loved one is still warm to the touch. And something we get a lot is, oh, well, I felt them grab my hand, which is a spinal reflex. But unfortunately, you know, that person has passed away. So having to explain that to families definitely took quite a lot of training. Every case is so unique. I mean, there's not one case that's remotely similar. This is due to medical history, how the person ended up at the hospital, and family dynamics. So families, we've gotten yelled at. We've had people pushed up against a wall when trying to talk to a family about their loved one. We've had families not understand what's going on. We've had families that maybe the parents are divorced, so there's friction, and it really is incredible the kind of adaptation you have to make to each family. And if you're working in healthcare, that's definitely something that you'll have to work in, is explaining these really complicated things to people maybe with not that much education. So these are the organs available for donation: the heart, lungs, liver, kidney, pancreas, and the small intestine. So we are actually really lucky. The bottom here says 1 organ donor can save 8 lives. We are so lucky in our area that 1 organ donor can actually save 9 lives. And that's because the liver, the smaller section of the liver, can actually be recovered in such a way where the smaller section can go into a child recipient. So it sometimes does get really hard because we work in only deceased donors. And, you know, working in death can be very, very difficult. The thing that really helps is knowing that, you know, that person saved 4 lives, 5 lives, 9 lives. And we get those emails with how many lives that person was able to save. Tissue donation, we always say organ donation is life-saving, tissue donation is life-enhancing. 99% of people who pass away can be a tissue donor. And that's because they do not need to be on a ventilator. It's just anyone who passes away. 1 tissue donor can enhance 50 to 100 lives. So the thing I always like to point out is cornea donation. And that's because I always imagine if I were to lose my vision at some point in my life, and then to have cornea donation and to have a cornea transplant, and then to be able to see things again. I mean, I always think, you know, we say tissues are life enhancing, but to me, that would be life saving. If I could get my sight back, it would be life saving if I could get donated bones, tendons, and ligaments and get my mobility back. Now I can go with a walk with my family. Donated heart valves for congenital valvular disease. The pericardium, so the sac around the heart, can actually go to repair the dura mater after brain surgery, which is really, really interesting. Skin for major surgery repairs, and saphenous veins for like bypass surgery in diabetic patients. So this is a good map of our service area. As we mentioned, 45 hospitals and 6 transplant centers. If I am working in DC and I get called down to Spotsylvania, that is a terrible drive. I mean, I've been called at 10, 11 at night to go down to Spotsylvania, which is a 2.5-hour drive. But as you can see, look at all these opportunities that you can get. If you are looking in public health, like the NIH, the CDC, the FDA, they all have home bases in Maryland. If you ever want to go to their campuses, they actually have quite funny street names. Well, I find them quite funny. It's like Healing Way, Hospital Boulevard. So they're all named after what's on there. And there's a big area in Maryland where all of these campuses are. NIH actually has like 3 campuses up there. So one thing about WRTC is we are federally designated, what's called an OPO, so an organ procurement organization. Every single hospital in the US has to have a written agreement with their OPO. So all across the US, every single hospital works with an OPO, and we are completely nonprofit. So working in a nonprofit and a federally designated organization, especially in healthcare, is definitely very unique. Of course, there's CMS audits going on right now, so it adds another level of, I would say, uniqueness to every day, just getting all of the data ready and files. But if you're looking at transplant centers, Inova Fairfax Hospital, so each one of these transplants focuses in a certain area. So Inova Fairfax, they focus in heart transplants. Children's National Hospital, of course, children's cases, but mainly heart. MedStar Georgetown, I know they do kidneys, GW liver. UC Walter Reed as well, which John, you were mentioning. And then MedStar Washington Hospital Center. So I put down here no shortage of hospitals at all. If you are looking to work in a hospital, I will let you know each one of these hospitals is very different from one another. Children's National Hospital, Veterans Affairs, and MedStar Washington Hospital Center are all 5-minute walks away from each other. But even if you go from unit to unit, it feels like going to a different country. I mean, it is so unique, each community on the in each hospital. So first off, what do I do at WRTC? What is an in-house donation coordinator? What is a hospital services specialist? One thing I do is I educate the hospital staff because we don't have access to every single EMR, electronic medical records, of every single patient. So the hospital has to refer a patient for the potential of organ and tissue donation for us to get access to the chart. So one thing I educate on is I educate the nurses to call, because something we don't want to see is when our quality team is going through medical record review and they see that this person could have been an organ donor and saved lives, but they weren't called in. So one thing I do is I help with the prevention of these issues. I also help with the medical evaluation of the potential donor. So I go there and I get the past medical history, how stable the patient is, where the family's mindset is at, So do they understand what's going on? I send out all of that information to our medical director. I speak with the families regarding their loved one's care and their decision to donate. So at Children's Hospital, it is a very unique approach because, of course, you're dealing with a population that's highly sensitive. And what we do in that approach is we dual approach with the social worker because they know them very well. I help clear up any potential issues. So family dynamics always has hiccups. Each family is very different, and especially in these crises, they can kind of come to light, and just working with the family to help them understand what's going on. Working with unstable patients, brain death testing. Brain death testing is very, very it's very, very unique in the way that everything has to be perfect, because you have to realize this person's heart is still beating, but you are declaring death on this patient. So there's a lot of focus on making sure that there's absolute 100% certainty that nothing in the environment is causing this person to appear brain dead, if they aren't. So just making sure everything around that is correct. Scheduling ORs, which, let me tell you, during COVID is a nightmare, and during any time is a nightmare. ORs are completely packed. If anyone here has tried to have an elective surgery in the past 2 years, you will know that it's extremely difficult to book an OR. Medical preservation. So in brain death patients, these people are legally dead. So quite slowly, their body starts to realize that this person has passed away. So things start to shut down, and there are some issues. So just making sure that the organs are not failing. I assist in allocating the organs to transplant centers, and then, of course, working with hospitals on their policies. So there's a little bit of everything. I like to talk about my little past before, because it kind of sets me up for this question of, how the heck did I get into this job when I have no medical background? And the answer to that is organ donation is so extremely unique that it requires a year of training anyway. Regardless if you're a nurse, regardless in your medical background, it is so extremely unique to just organ donation that you have to go through that training anyway. I would say my main base hospitals are MedStar Washington Hospital Center. So MedStar is our major healthcare organization in DC. Children's National Medical Center. So I'm sure some of you have probably seen the little teddy bear logo for Children's Hospital. And DC Veterans Affairs Medical Center, and then HSC Pediatrics. Washington Hospital Center is the main trauma hospital in DC. So all of the major traumas, they'll go to hospital center. Children's, again, you're working with the children population. Veterans Affairs, all of these are so different because, of course, hospital center, you're working with the whole public on all traumas. Children's and pediatrics, you're working with the younger population, and then Veterans Affairs, you're working with that the veterans population. So we work with a variety of hospital staff. I mean, we work with everyone from, like I mentioned, social work to chaplains, ICU staff, to the attending physicians, OR staff. I mean, anyone who is involved in an organ donor and a tissue donor, we work with. So we even work with admissions and executive leadership. Something I always like to say, if you are working in healthcare or in health in general, or just really any job, find your silver lining. There are such great, I guess, there's a lot of difficult days. You're working with people where this is a worst day in their lives, and sometimes you'll absorb that terrible day. So going on year 3 of a pandemic can stress a lot of people out. This little note letter that I've put on the right is my little silver lining that I found. These are recipient and organ donor letters. So the organ donor's family and the recipients can talk to each other through letters, and they can meet each other. And this is an example of a letter. So I'll just read a very tiny bit of it, but this letter is written with both sadness and gratitude for the simple fact that you said yes when you were given a chance at a new organ from Kayla's tragedy. We write this letter as a survivor's mother, father, sister, boyfriend, and puppy of 10 months at the time Kayla left us. So this is just something where in a typical letter, the donor family will receive a letter that says, your son's liver went to go save a father of 3 in Maryland who can now go watch his kids play soccer on the weekends. Very, very general, but to that family who have just lost a loved one, it truly means to the world. I mean, these letters, we have something called virtual donation resource specialist training that's free and virtual and provides continuing education credits for healthcare workers. And we have donor family members come and speak at it. It is every single time I have to turn off my camera because it makes everyone tear up. I mean, it is incredible to hear these stories from this certain individual who lost his brother. And he talks about how his brother saved 5 lives and speaking with families and how much the healthcare workers truly helped him through the grieving process. Of course, I like to talk about some common questions and concerns we get regarding donation. These are some that we get from nurses, so they're always very interesting to answer. Can we have an open casket funeral? Absolutely. So our recovery specialists, you would not be able to tell who was an organ donor and who wasn't, or a tissue donor and who wasn't. All major Eastern and Western religions are supportive of donation. And then, of course, the rest of these, like, I won't go over all of them, but it will not cost anyone a dime to donate. We actually cover all of the costs from the family from that time of authorization. So degrees that have to do with improving the public's health will always be needed. This is something I told my family when I told them what I wanted to go into. There will always be sick people who need people like you, always. That's something that will never change in this world. You have your degrees, now what? Something I kind of realized a little too late was to apply super early. Don't be discouraged by job searching process. It can be very discouraging at some points. You know, we all have the term ghosting, and sometimes you can get that from these places that you apply to. I was applying at about 40 places a day because, of course, I was coming out of university. And I think probably about 3/4 of the jobs that I applied to, I never heard back from, or I'm hearing back from now 2 years later. Create relationships with potential jobs and cater your resume to each job. Change it for every single job that you apply to. For your interview, you are also interviewing them. Very, very important. And so I know that we have a lot of different departments here. So I'll just go into exactly what jobs you can look out for, especially in DC, for each kind of area. And if you're working a certain area and you have any questions about organizations to look out for, please ask a question. There are so many research organizations and health organizations in the area. One thing in public health, I put a little contact tracer free online training message here because that's actually something I did while I was looking for jobs. It's still free. I checked yesterday. You can go online to Coursera. They have free certifications you can do there. It's an 8-hour course, I believe. And then you get your certification in contact tracing to be able to work in the, to help trace, potential outbreaks in COVID. So that's something that kind of helped put another little unique thing on my resume. If you want to work in public health, there are public health consultants, researchers, community health. You can work in policy. I mean, DC is right there. If you want to work in anything policy or government related, DC is definitely your area. Health education. And I always say, if you want a demographic that you want to help, there is a job for it. In public health, I actually put there are too many organizations to put in here. Because if you're looking at government, I mean, you can look at the CDC, FDA, NIH, HHS. Local government has a lot of hirings. And like I mentioned before, look in the Maryland area if you're looking for government health organizations. American Red Cross and the American Heart Association, they're actually probably about a 10-minute walk from me right now here in Arlington, Virginia. If you drive anywhere in Virginia, you will drive past Johnson & Johnson, AstraZeneca, Moderna, Pfizer, all names that we got pretty accustomed to hearing. American Institutes for Research, just a hint, if you're looking for a really high-paying research job, they're the organization to look for. Their salary for research jobs are typically higher than usual. And then there are specialties. So if you want to work in a specific cancer population, HIV population, opioid epidemic, working in health deserts. So for those of you that have studied in public health, that's of course when there are no grocery stores nearby. So, and there are only fast food places and liquor stores. So working in the community to help that. But like I mentioned, if you want to help a certain population, there are always there's always an organization for that. So I put the little HOPE Act. That's actually some people don't realize that organ donors HIV to HIV is possible, and that's through the HOPE Act, which was only started about 10 years ago. Now, if you're looking at healthcare, so many options. I put nursing here, a lot of options. Right now, there's actually a huge turnover going on healthcare. 3 years in it, well, almost 3 years in a pandemic has really created a lot of burnout. So there's a lot of job opportunities for nursing in these major hospitals now. Travel nursing is actually decreasing. Hospitals are looking for less traveling nursing. And something I always say is find your unit. Like I mentioned, each unit is so extremely different from the last. The ICU is completely different from the emergency department, from med-surg, the OR, long-term care, palliative, orthopedics, pediatrics, so extremely different. Physician assistants, DC is in need. There are so many physician assistant opportunities. I actually, before this, I went onto our patient portals at MedStar, Washington Hospital Center, and at Children's, and there were about 800 job postings on each one for potential physician assistants at their different campuses across the service area. If you're looking to work at a major adult healthcare organization, the ones to look for are MedStar. So MedStar is a major DC one, Johns Hopkins, which is in Maryland and DC, and Inova. Inova's in Virginia, and then of course Children's for the younger population. If you're into athletic training or health sciences, physical activity jobs, the job areas are athletic training. Like I mentioned, that was actually the road I was starting in. And I did a lot of internships around and volunteering in athletic training and health sciences. And I can tell you that a lot of people in my degree end up going through that route. So there are so many new gyms popping up that I've never heard about before. There's one nearby called F45, which is apparently really, really popular now. It's the new CrossFit coming up, which is just primarily dumbbell workouts. There are college and professional sports teams. So I think they're called the Washington Commanders now or something like, I don't know what their new team is now. But there are a lot of sports teams. The Caps, the Washington Capitals, they actually train in Boston, Virginia, probably about 10 minutes away from us as well. And then physical therapy and occupational therapy. There are a lot of healthcare opportunities. One of my old roommates actually worked at MedStar Washington Hospital Center as a physical therapist during his clinicals. There are a lot of small clinics, a lot of privately owned clinics. DC and Virginia, they are very popular for people going out and running, and there's a lot of people that, let's say, they need physical therapy. There's a lot of population, there's a lot of athletic population. So the options are, you can work in healthcare, small clinics, sports teams, rehab, and then research. And I put some of the hospitals right now that you can work at as an occupational therapist. There are so many options on types of work, organizations. So how do you choose? Look at what will help you for your career. So something I looked at when I was doing my internships and volunteer work was, what is my future employer going to look at this job? How are they going to look at this job? So was it a step forward, kind of a small step into my future job, or what population and demographic do you want to work with? I say that a lot because that's someone who you will be working with constantly, is that population. So I always say I like to work with my population. I like to work with families who have just had a terrible, probably the worst day of their life, but being able to give them a little bit of hope and a little bit of grief. Choose an organization with a mission that you believe in. When the times get really, really rough and you're getting called in the middle of the night, it really helps to know that your purpose is well, what you believe in. I believe in every time I get called and I have to work out an issue, that I can help save someone on that list. And get started on building your resume now. Those Coursera free online classes, the COVID contact tracing is actually from Johns Hopkins University. So again, it's another little good thing that pops up on your resume. And research your degree. This is just a quick little Google I did, or an Indeed search. So just 20 jobs you can get with a health science degree. And it has everything from jobs to average salary and their growth potential. Of course, I take that with a little grain of salt. But it just lets you know all of the options and, of course, what salary you should be looking at. So my best advice to all of you, this is something that I learned not too long ago, and it's something that's really helped, is self-validation. You all are amazing to be where you are at right now, and working in the healthcare field, helping others, it's really important to know exactly what you're doing correctly. It was something that I struggled with a little bit at the beginning, because I was always wanting, my boss every single time I did something right to tell me good job, but sometimes you won't get that. So it's really important to tell yourself just how great you're doing, especially in these pandemic times. And now I want to give enough time for people to ask questions. If there are any questions about really anything regarding DC, what to do in DC, education, or what it's like working in a hospital, or
Okay, do you, if anybody has any questions, for one thing, if you want to just raise your hand and click in and start questioning, we have a couple questions that were sent in advance. And hopefully maybe we'll get some in the chat room. So does anybody have a particular question that they want to ask at this particular time?
So Junior has raised his hand. Junior, go ahead and unmute and ask your question.
Yep. Hello, hi. I'm Junior. I'm an accounting major here at King's, and I actually want to ask. You talked about donating, like being like an organ donor, and like that could be something like no matter like what degree you have or what career path you choose. So I just want to know. And you said like the training is about like a year of that, anyways. So if anyone that has like any other profession other than like healthcare, could they still potentially be able to like work out like doing that training or anything like that?
Absolutely. That's a great question. The person who I actually replaced in my first year when I started working at WRTC, he was an international business studies major. And he actually gave up his position at WRTC to go study his master's in international business studies in Italy. So we have a wide variety of people with different degrees, and the main thing is just like you mentioned, you're getting that years of training anyway, and sometimes it's actually easier to build from nothing than it is to break down some myths in the healthcare field and then try to build it up. So absolutely, you can have really any degree and work in healthcare. There are also something I was looking at prior to joining WRTC was working in like the admissions and administration department in hospitals, because at the time, you know, just like you, I wanted to work in hospitals, but I thought I couldn't because I had a public health degree. So I was kind of looking at a way in to see if there's any way that I could work in a hospital, and I kind of fell into it. So to answer your question, yeah, there's absolutely, it doesn't really matter what your degree is as long as you're able to, during that interview, let them know how that'll help you in that position.
All right, great. Thank you so much. That really helped. Thank you.
No problem.
I have a question, Robert. I know you went for a master's degree in the health area. Basically, pretty much what you're saying is you really don't need an advanced degree to get into the health field. But do you feel it's worthwhile to be able to do that? I presume you did yours on a part-time basis at nighttime.
So I actually did mine full-time. Being an international student, I couldn't work and be a student at the same time. So the master's really helped me in my situation because I was still not really 100% sure what I wanted to do with my degree and my work. So it did help elevate you know, just really my understanding of what I wanted to do, because this master's program, I went over healthcare data analysis, I went into epidemiology, went into community health, even personal training. I mean, all of these classes just kind of helped me figure out, yep, I like that. Nope, I don't like that. It also helped me with the education side. I mentioned it earlier where when I was graduating, personally, I didn't feel like I was ready to work in this field. I thought I didn't have enough knowledge really to go into my field. So I wanted to go back to school to try to really just get the education and to get the confidence to work in public health as well. At the time, I kind of thought I was going to work in policy, which you need a lot of confidence to work in policy.
Have you seen in your experience dealing with the hospitals and also with the other transplant centers, do you see that further education is being paid for by those companies, hospitals?
Yeah, Yes, absolutely. So I was mentioning my EMT and EMS certification, which is paid for by my organization. Something you also get in healthcare is continuing education, which sometimes you have to pay for them, but a lot of times they're free. And it really helps out with the employee and the organization because you get free education and something else to put on your resume, and they get a more intelligent employee who maybe is a bit more knowledgeable in a certain area. I know with physical therapy, my old roommate for, well, I think we were roommates for about 6 years. So through all of undergrad and grad school, they're actually paying for him to get a specialized physical therapy training certification in golf to help people who have had an injury and still want to play golf. So that helps the clinic, the physical therapy clinic, bring in that population, and it also helps him for his future because he gets that certification on his resume.
I have another student who has a question. Nusrat, you can go ahead and unmute.
Hi, Robert. It was a great presentation. So I have a specific question related to your job. So getting organ donors can be a very challenging task sometimes. So what is the most challenging part of identifying and building relationships with potential donors? In other words, what methods have you found to be useful in securing commitments from donors?
That's a great question. I had mentioned earlier, about each family is very uniquely different. So the hardest thing is building that rapport with the family because they are going through the worst moment of their life. They don't want to hear about their loved one passing away. They still see that their loved one might look like they're alive. So the best strategy is to kind of see where they're at. One thing we want to make sure 100% is that they know that their loved one has passed away. We never want them to think that they have just given up on their loved one. So something that we'll discuss is, I'll introduce myself and I'll say, so what did the physician tell you about brain death? And then they would say, oh, well, they told me that they did some testing and that he's dead. Okay, well, what is your understanding of that? And then they'll say, oh, well, his brain's swelled and then it cut off his blood supply to his brain stem, but I don't really know how that actually caused him to pass away or why they didn't do anything to help him. And then you would answer their questions, and then you would ask again, does that help better understand? Can you let me know what you now know about this? And it's just constantly going back to, okay, what do you understand? Because it is such a complicated and unique issue. I always say it's because I've never seen brain death talked about on like a medical drama show or really on the news or anything. So you don't get that exposure to brain death until your loved one's in that situation. And then you may have a physician telling you, well, there's no blood flow at the circular Willis. We had to drain CSF to help decrease pressure. Families do not understand that. So it's really important to, first off, just gauge where they're at, maybe their knowledge and understanding. Some have family members who are medical professionals that they can kind of help fill in gaps. Some know absolutely nothing. A big issue in organ donation is that there are a lot of myths and misconceptions. So typically we get a no because the family has a myth. So trying to dispel that myth early on. A big myth is, well, the hospital didn't want to care for us because you just wanted their organs. And then that's when, you have to explain that the hospital staff helping you and the organ donation team are separate, that they don't talk to each other until the loved one's in that situation. So there are a lot of myths that you have to kind of figure out when a family says no, of course, you don't want to say, oh, but why? So a way of kind of asking that question is, okay, I completely respect your decision. Would you let me know just if there's a reason why you said no so that I can maybe help fill in some gaps? And then they might say, oh, well, my religion doesn't support it. And then you would ask, oh, well, what religion are you supportive of? Maybe I can get our religious leader in contact with you. So just those kind of, yeah, it's all about adapting. I mean, again, we've had families that when we go in and we say, I'm so sorry for your loss. I understand the physician told you that your loved one has passed away. And then they push our staff against the wall and they threaten to beat them. Because at that moment, they're so frustrated at being told that their loved one has passed away. So it really is kind of a gamble of what kind of family you're going to run into. I hope that answered your question.
Yeah, thank you. That was very insightful. Thank you.
No problem.
I think we have time for one more question, and we have one in the chat. Tiffany asked, are there a lot of jobs available for healthcare management? Maybe just touch a little bit of what you know about that.
Yes, absolutely. Healthcare management is something that, looking at hospitals, there are a lot of people in healthcare management who are leaving currently, again, probably due to being 3 years in a pandemic. So when it comes to healthcare management, are you specifically looking for like in a hospital, or are you looking for maybe like an OPO, or like a research organization? Because hospital management is a very wide a net. I mean, there are so many opportunities. If you have healthcare management degree on your resume, you can kind of throw a dart at a board with all of the healthcare opportunities. I hope that kind of answered the question. And I also want to make sure I answered an earlier question in regards to physician assistants at Children's as well.
Mhm.
So I think there was a question regarding opportunities for physician assistants at Children's National Medical Center, or for pediatrics in general. And I had kind of mentioned it earlier where I was just curious, and I knew there are opportunities. So I did a quick little search on our patient portal at Children's, and there are 803 available positions at different Children's Medical Center campuses. So it's everything from, I mean, I'm looking at from physician assistants focus in neurology. They even, at Children's, they even do free 12-month training programs for physician assistants looking to get into emergency medicine at Children's. They have a lot of neurosurgery. So if you're looking at neurosurgery for children population as a physician assistant, look at Children's National Medical Center in DC. And then, yeah, I think that kind of answers that question. I don't know if there's a follow-up, but definitely if you are in the physician assistant program, there are hundreds and hundreds of opportunities, and I would love to see some of you walking around the campus at some point.
All right, well, thank you, Robert. I think we got a lot of information about the healthcare system in DC, a tremendous amount of information about the transplant area. So again, I want to thank Robert for his presentation, and just want to have a little advertisement that at 6:15 in 15 minutes from now, we'll have our last session of the Career Day program, and that will be how recent federal legislation to rebuild our infrastructure and meet the competitive challenge from China will create millions of good jobs in America. So that's the last one of our Career Day program, and hopefully we'll be able to have some of these people who are present during this conference to be able to click in on that one. So with that, like I say, thank again to Robert, and thank again to the King staff for all the assistance they have. Thank
Yeah,
you.
thank you. I am out of breath, so
Robert, thank you so much.
Robert.
thank
It
you,
was really
everyone.
Fascinating.